Alabama Rise and Cover Alabama joined with the American Cancer Society Cancer Action Network to host a Medicaid Expansion Advocacy Day on Tuesday, February 25th in Montgomery. Nearly 100 passionate supporters came to the State House to speak out in defense of Medicaid and the urgent need to close Alabama's health coverage gap. Several people spoke about the devastating experience of losing Medicaid coverage and falling into the gap, earning too much to qualify for Medicaid, but too little to receive federal tax credits to help pay for health coverage. Their testimonies underscored the urgent need for Alabama to expand Medicaid so everyone can get the health care they need to survive and thrive.
I'm here with many advocates from across the state to ask the legislature and Governor Ivey to close the coverage gap and expand Medicaid. Right now, around 200,000 of our friends, neighbors, and family members are caught in the Medicaid coverage gap. They work hard, taking care of our children, serving our food, stocking our grocery store shelves, but they can't afford to see a doctor when they're sick. And when they can't get the care they need, it doesn't just hurt them, it hurts all of us. When people don't have health coverage, they aren't able to see a doctor for regular checkups or early treatment. That means preventable conditions turn into expensive emergencies.
Hello, I'm Kiana George from Camden, Alabama, or as they call it, Wilcox County. Our story is pretty simple. I lost coverage back September 2023 when they did the whole whatever. And then I've been basically kind of fighting for my life ever since, because I've always had blood pressure issues since around about maybe 2015, 2016. I called Medicaid and they told me because I made more than $295 a month that I didn't qualify. And then I called the marketplace and I don't make enough money to get an insurance claim. So what am I supposed to do? What am I supposed to do? I started getting bills in the mail, and then that kind of discouraged me from going to the doctor, because if I'm already in debt, I can't pay you. If I don't have the money to get insurance, I don't have the money to pay you for not having insurance. And then I stopped taking my medicine back last year because it was making me sick, but I was too scared to go back to the doctor to get it changed because I thought they were gonna make me pay for it. And after that, not a good idea, because guess who ended up a month after turning 30 in ICU in the hospital for stroke level blood pressure. I did. As a matter of fact, while Jackson was boycotting outside, I was inside the hospital in ICU and didn't even know it. I would really, really appreciate all the lawmakers, all legislators, all governor, anybody. I have a 9-year-old. I want to see my baby grow up. If I don't have coverage, I'm not gonna be able to live. Thank y'all.
I'm Angelica. I came down here from Birmingham. My story starts at birth. I was on Medicaid as a baby when my parents first moved here. My mom worked 3 jobs while my dad didn't work at all, so the Medicaid was the only way that we survived as children. Fast forward 18 years, 19, I get dropped. Start working in the service industry. Everybody, if you're familiar with the service industry, they are not legally required to offer health insurance to anyone. So if you take your career in the service industry, you're not going to get health insurance unless you pay an arm and leg for it. So ultimately, I resulted in having to get Medicaid for my daughters as they were born. Medicaid would only cover me while I was pregnant, and that was it. They cover my children now. It's confusing for me about why they will cover my children to be born, but they will not cover me to continue to be healthy, to be alive for them. On top of that, my 9-year-old was diagnosed with a soccer ball sized tumor last summer in her right ovary, and Medicaid, thankfully for Medicaid, we were, I didn't have to pay $200,000 for her to have her surgery. That was a really difficult time to be able to, and then also having to fight for that coverage for my children to live. It doesn't seem humane in a lot of ways. And a lot of people that are having to fight to provide for their children, we shouldn't have to fight this hard for it. So we're just hoping Alabama can, come with the Medicaid gap and help everybody actually just be able to exist healthily.
I'm a businessman from Birmingham. Why am I here? For two reasons. One, because I believe that we can do better as a state. I'd love for my children and my children's children to stay in this state and make it a better place to live and work and raise a family. But think of this, if we expanded Medicaid, it would have close to $2 billion of positive economic impact on this state. Think about that. Our rural hospitals will have a chance to survive.
Alabama is losing billions of dollars that could have been invested in our healthcare system. It's time to stop pointing fingers and start leading. The time for excuses is over. The time for action is now. Let's expand Medicaid. Let's save lives. Let's cover Alabama.